So today, we're going to dive into a really fascinating medication called trihexyphenidyl. For a long time, it was one of the only tools doctors had to fight something like Parkinson's disease. And at its core, the whole idea behind this drug is about restoring balance, almost like leveling a seesaw inside your brain, to help people get back control over their own bodies.
I mean, just imagine what that's like. Imagine your hands start shaking and you can't make it stop, or your muscles get so stiff it feels like you're trying to move through concrete. That's the reality for people with certain movement disorders. And it all comes from this tiny, microscopic imbalance deep inside the brain. All right, so to really get a grip on how we can treat these conditions, we first need a picture in our heads for how movement is even controlled in the first place. And honestly, the best way to think about it is like a perfectly balanced seesaw, with two different chemical messengers playing on each side. Okay, so let's meet the two players on our chemical seesaw. On one side, you've got dopamine, and on the other, acetylcholine. In the part of your brain that controls movement, these two are in this constant, delicate dance. And when they're perfectly balanced, your movements are smooth, they're controlled, they're exactly what you want them to be.
And this slide just lays it out perfectly. You can think of dopamine as the brakes. It's there to inhibit and smooth out all the little movements you don't want to make. And on the other side, acetylcholine is the gas pedal. It's what promotes muscle activity and gets things going. In a healthy brain, they work together in perfect harmony. But here's where things go wrong. In a condition like Parkinson's, the brain cells that make dopamine start to die off. And all of a sudden, the brakes are gone. The seesaw just slams down on one side, leaving the gas pedal, acetylcholine, totally unopposed. And that imbalance is what directly causes the tremors and the stiffness. So if the problem is a tilted seesaw, how do you fix it? Well, you've got two options, right? You could try to add more weight to the low side, and that's what other drugs do by boosting dopamine. Or you could just lighten the load on the high side, and that is exactly where trihexyphenidyl comes into play.
It's a beautifully simple idea when you break it down into these three steps. First, you've got the imbalance, way too much acetylcholine activity. Then, trihexyphenidyl comes into the system and acts like a shield. It physically gets in the way and blocks acetylcholine from delivering its message. And by doing that, it reduces acetylcholine's power, helps level that seesaw back out, and allows for much smoother movement. It's simple, but it's incredibly clever. Okay, so we've got the how down. Now let's talk about the who. Which patients, which specific conditions actually benefit from this chemical rebalancing act? Well, it's got a few key jobs. It's used for Parkinson's, especially when tremors are the biggest problem. It's also used for other conditions with muscle spasms, which we call dystonia. But, maybe its most critical job is for something called drug-induced Parkinsonism. And this right here, this is so important. A lot of really essential antipsychotic drugs work by blocking dopamine. The problem is that can cause the exact same movement issues you see in Parkinson's. Trihexyphenidyl is an absolute lifeline in these cases because it fights those side effects. It lets patients stay on the psychiatric meds they desperately need. But, there's no such thing as a free lunch in pharmacology. The very thing that makes this drug work so well, blocking acetylcholine, is also the direct cause of its widespread and often really annoying side effects. It's just the inevitable cost of taking such a powerful action. See, the problem is that acetylcholine isn't just in the brain's movement centers, it's everywhere. So when you block it in the rest of the body, what we call the periphery, you get things like dry mouth, blurred vision, constipation. But when you block it centrally, inside the brain itself, the effects can be a lot more serious. We're talking confusion, problems with memory, and sometimes severe drowsiness. Okay, so because this drug is so powerful, there are some major red flags we have to talk about. These are situations where trihexyphenidyl has to be used with extreme caution, or in some cases, not at all. And this is absolutely critical for patients with conditions like glaucoma, which deals with eye pressure, or myasthenia gravis, a muscle weakness disorder. This drug is a definite no-go. And there's a huge warning for elderly patients. They're just so sensitive to the brain-related side effects, and it puts them at a massive risk for confusion, memory loss, and really dangerous falls. And then there's this, a really surprising twist. Because of its powerful effects on the brain, at very high doses, this medication can actually cause feelings of euphoria and even hallucinations. And unfortunately, this has led to it having a potential for abuse, where it's sometimes known on the street as pinkie pie. And the danger doesn't stop there. If you combine it with other things that have similar side effects, think about it: alcohol,
over-the-counter sleep aids, even some common allergy meds, you create this dangerous pile-on effect. It can ramp up the drowsiness and confusion to a truly risky level.
So, when you step back and look at the whole picture, what do we really have here? What we have is a medication that is, without a doubt, a powerful and historically important tool. But it's also one that is deeply complicated and comes with some pretty significant risks.
You know, this quote from our source material just nails it. It's a valuable agent for sure, but its usefulness is sharply limited by the very thing that makes it work in the first place. Its broad action across the body is both its greatest strength and its greatest weakness.
And this leaves us with a really fundamental question that doctors and patients have to wrestle with every single day. The story of trihexyphenidyl isn't just about one drug. It's a perfect case study in the constant, delicate balancing act of medicine itself. How do you weigh powerful benefits against equally powerful risks?